And up to 30% of people can have an infection in the stomach called Helicobacter pylori, which is very treatable with a week's course of medications. We can diagnose that with endoscopy or other tests, including blood tests and stool tests. Hello, I'm Dr. Mohammed Shariff, a specialist in gastroenterology and hepatology working in the Hertfordshire region. And today I'd like to talk about upper abdominal pain. This is a symptom which is suffered by most people in their lives and can be experienced in lots and lots of different ways. For example, some patients might have severe pain that takes them to accident and emergency, whilst other people might have a mild background pain that is getting worse over a slow period of time, or that only comes on during certain activities. And trying to tease out the cause of the pain is the really interesting part of my job, but also trying to work out what investigations are going to help is really important in trying to make patients better. As I mentioned before, most people will develop upper abdominal pain at some point in their lives, and up to 30% of those people can actually have a mild infection of the stomach, which is a cause which is very easily treatable. That infection is called Helicobacter pylori, which I'll talk about in a moment. But when I'm taking a history, that is the story from the patient about their discomfort, there are certain clues in the history that help me head towards the correct diagnosis and therefore treatment. And it's all based about the way we learn about these things in medical school. At this most basic level, the location of the pain can give you a clue as to its cause. The upper abdomen, and by that I mean above the belly button and below the rib cage, has within it lots of different organs. For example, you have the stomach, and that's where the food goes in and sits and is initially digested. And the stomach then links to the small bowel, which is called the duodenum. But right next to that area, you can also have problems with the gallbladder. The gallbladder is an organ in the tummy that stores bile, which is a fluid you need to digest fats. But you can get things called gallstones in there, which can cause issues. But in addition to this, you have the other layers of the abdomen as well. So in front of those organs, you have the layer which holds it all together, which is a band-like material called the peritoneum. And above that, the muscle layer, the ribs on top of that, and the skin on top of that. And interestingly, you can have discomfort arising from all of these different areas. So starting from the deep areas, you may have something called a stomach ulcer. That's when the lining of the stomach gets abraded and eroded, becomes very painful. And that classically gives pain immediately after eating and can be well treated with anti-acid medications, or if it's being caused by this infection, this bacteria called Helicobacter pylori can be eradicated with a course of medication just for a week. You may also get ulcers in the other part of the bowel I mentioned, the duodenum, which can be treated in a similar manner. Lots of people develop gallstones, and these are hard little stones in the gallbladder, and they come about because bile, which is this fluid that you collect to digest fats, can crystallize out and make stones. Now, interestingly, a lot of people have gallstones, and most people will never get any problems from them. But some people can develop infections or inflammation around the gallstones, which can cause a pain that can happen half an hour to 45 minutes after eating, and classically causes what we call biliary colic. And a colic type pain is one that waxes and wanes, gets very severe, and then gets better. So there, again, the history is very important. Now, you may investigate these different problems with different tests. I mentioned before that I undertake endoscopy, which is a camera test where we pass a thin telescope tube into the mouth, down the food pipe and into the stomach. Most of the time we do this with sedation, so the patient's very comfortable and asleep. And it's an extremely valuable test in allowing us to see the lining of the stomach, take samples if necessary, take photos and make diagnoses. And we can see the whole of the stomach, the food pipe, the duodenum, and sometimes even a little bit further. Another extremely important test is an abdominal ultrasound scan. Now, you may have heard of ultrasound scans. They're done for looking at babies in the womb. You can do ultrasounds of the heart, but a specialist radiology doctor can scan the tummy and see if there's any problems in the gallbladder. And very experienced radiology doctors can even pick up problems, as I mentioned before, in the abdominal wall layer. So If you've had previous surgery, you may have what we call a little entrapped nerve, which can cause discomfort, and that typically causes sharp pain in one particular area. We may also diagnose with ultrasound problems between the ribs. That's called costochondritis, which can occur in lots of different patients, usually through a viral infection, which typically causes a pain which is worse on breathing in and is very sharp in nature. That may respond to simple painkillers, but it may also respond to a localized injection of medication to improve the discomfort. So there are lots and lots and lots of different causes of abdominal pain, and what might sound like quite a simple symptom can have a lot of different causes that need to be appropriately investigated and treated. And I hope I've given you a good overview of those different problems, the most common ones, and what we can do about it. Thank you.